Everybody, this is Sergeant Major Mooney. Thank you for dialing in to the COVID-19 virtual town hall. With me in the room, I have Major General Hronek, Doc White, and Captain Koeppen. The hope is to demystify some of the things that we're all seeing on the internet about COVID-19 and the vaccine, and hopefully educate the force. So again, thank you for dialing in, and with that, I'll pass it over to Major General Hronek.
Thank you, Sergeant Major Mooney. I appreciate the time we have to talk with you about the vaccine and the dissemination of this vaccine against the pandemic we're currently struggling through. And the reason I want to talk really is we're in a unique situation in the Department of Defense and our allocations to take care of our service members versus the population at whole. And I think sometimes there's a confusion about that. So we're given our own allocation as the Department of Defense to inoculate our service members. And of course, that can't be used to the general population. The problem I have right now is I have more vaccine than those that are willing to take it or know that they could take it. So if they think maybe if I don't take it, it can go to somebody else, but that really is not my case. So really, I'm trying to increase awareness, because to me, awareness equals prevention. The more we have people aware, they know how we can prevent this pandemic. This is one great tool that we have is the vaccine that we have. So what I'd really like to do is right now my take rate's right in a little above 20%, and I don't know if it's necessarily there's fears about the vaccine, or if there's just, I think this doesn't need to really be for me, I can give it to somebody that's healthier. But my bottom line really is for us to be ready service members to have the vaccine. We're not only protecting ourselves for the call of duty, but protecting our families and our friends. And I think that's so highly important that we do. We know we've had many vaccines in our lives. We know that what it is to serve. And I'm just asking you to listen to Doc and the captain here to give us the information you may need to go forward and to take the vaccine, which will help not only us and to each other. So with that said, I'd like to kick it over to Doc White, please.
Thank you, Major General. So I'm Colonel Bronson White. I think most of you have met me. I've got lots of FaceTime across the state with National Guard members and Air National Guard as well. We're welcoming them to this broadcast. Much like you, I grew up, a bunch of you in the audience, I grew up on a ranch. I speak plain and simple. I think for myself. I make my own decisions. And what Captain Koeppen and I would like to do today is kind of lay out the general science of what we do know about the COVID virus and the illness that's come from it, and the available vaccines and how those work, and why you may or may not be a good candidate to get it. Okay? So first off, Captain Koeppen's been instructed to kick me in the shin if I get too sciencey here. So a little bit about how this disease works and spreads, and then I want to talk about the vaccine itself, because some people read things on the internet or read it in magazines, and it can be spooky, and you don't always have all the information you need to make an informed choice. So coronavirus, they've been with us for many, many years. This is a unique new strain, and it has continued to change like we expect to see with viruses. Coronavirus is the basis of what most of us refer to as the common cold. It's not a bacteria, it's a virus. A virus is a little simpler organism than a bacteria is. And coronavirus has been around a long time. If you look at the label on your Lysol can, it will say it kills coronavirus. Well, it said that 5 years ago too, because coronavirus has been around for a long time. This is just a new version that we think emerged out of China. So what is the difference between a bacteria and a virus? A bacteria is what we often get with strep throat infection or certain pneumonias. When you get an infection in your skin, that tends to be a bacteria. It's a small microscopic organism, but that organism is actually fairly similar to the cells that we're made up of. It has the same components and structure to it. So when we take something like an antibiotic, we have to design that medicine so that it finds something unique about the bacteria so that it kills bacteria but doesn't kill our own healthy cells. Similar sort of thing occurs with a virus. A virus is a much simpler cell. It doesn't have all of the bits and pieces that a human or a kangaroo or a rat or a soldier might have. So what we do is, why is it that we had to come up with a new vaccine to treat this? Well, if you think back, and I just explained that really this is a similar organism to what causes the common cold, that's been a scourge of us for our entire lives and our grandparents' lives and our great-grandparents' lives. And we haven't been able to develop an immunization against the common cold because it's a very difficult, technical, challenging thing to do. The way that a vaccine for a virus works depends on the type of vaccine. So one of the common questions that we get is this going to cause coronavirus? Is this going to make me get sick? So I'm going to talk about how this specific vaccine works. There is no virus in this vaccine. There was never a virus in this vaccine. We have other immunizations that we get that might be made up of a version of that virus that doesn't make people sick, or a little piece of that virus so that your body can recognize it and develop an immune response to it. With the coronavirus, what the scientists did is they identified a unique part of that virus. So picture a face with some whiskers sticking out. Those whiskers that stick out of that virus are unique to the virus. We as humans don't have those same little proteins sticking out. So what the virus does, or what the vaccine does, is it teaches your body how to recognize those little foreign particles and develop an immune response to it. We're not sticking those little particles in you. There's no part of a virus in this vaccine. It just the vaccine teaches your body how to generate its own immunity against those little whiskers. When we get to the end of our little conversation here, we're going to have a question-answer period, and if there's something that Captain Koeppen or I do not cover in the science or the logistics of how it is that we're going to get this vaccine out to people, we'll be happy to field those questions until they've been addressed. Much like Major General Hronek has said, we have a challenge as service members and a responsibility. When we take an oath to serve our country, we accept that we have a higher responsibility than other members of our community. That's part of the pride that we have when we wear the uniform. In this situation, we also have an opportunity that some of our community members don't have. As Major General Hronek laid out, we're required to vaccinate our soldiers and our airmen. We don't follow the same strategies that you see from the Public Health Service and the CDC and other federal and state agencies. Our mechanism is we need to get all of our soldiers vaccinated so that when and if we're needed as a strategic element for national defense, we're available, healthy, and ready to go. So I think it bears repeating what the General said. Don't feel like you shouldn't be getting your vaccination because somebody else might be in line waiting for it. The important thing for us to do right now is take the supplies of the immunizations that we have and distribute those. Get those into soldiers and airmen's arms. That's the most important thing we can do right now. You know, I'm sure there's going to be questions about, well, what about if I just catch the illness and get better on my own? What if this, what if that? And we'll try to address that again. I'd like to use an example of what we as the military try to do differently than some of our civilian peers. I was stationed in Africa with the Special Operations element in 2010 for a whole year. And as the military, we go in ahead of time and we look and we say, what are the threats against our service members here? Could they be exposed to malaria? Are there venomous snakes? Is the air poisonous? Is the water poisonous? We look at those things and we control those factors that we can address, that we can control. So an example would be malaria. Malaria is a little small organism that is transmitted by mosquitoes, and it causes a disease, malaria, that really never goes away. Some of you may have Vietnam era friends, colleagues, peers that contracted malaria when they were down in Southeast Asia, and it can come back throughout your life. It shows up as fevers and sweats and a very challenging condition. It's also a very easily preventable condition. The military has rules about you need to wear the proper uniform in the proper manner. So if your boots are tucked in, your sleeves are all the way out to the end, you have DEET type treatment on the fabric, you follow our guidance, that minimizes your exposure to being bit by the mosquitoes in the first place. Depending on where you're at in the world, we might give directed therapy with a medication like doxycycline that prevents you from getting that infection. And I can tell you with absolute certainty that when I was in East Africa, the soldiers and sailors that I was working with that took their medication and wore their uniform properly did not contract malaria. There were a couple of cases where we did have service members that contracted malaria, and these were people that did not wear their uniform properly, and they did not take the medication as they were instructed to. Many of the civilian contractors that we worked with did come down with a very dangerous form of malaria. They didn't have a uniform, and they didn't have directed therapy medications to take. So I've seen it with my own eyes, that if we control the things that we can control, those factors, we can make a difference. So if you're of the mindset that you're a happy, healthy 20-year-old and you don't need this vaccination, I want to remind you that you have a higher obligation to the community and to your own family that you don't contract this, spread it, and get it out in the community. So I strongly urge you to take the vaccination and help us fight this disease, because this is our fight right now. Captain Koeppen, do you have anything to add?
Thanks, sir. Hi, everybody. Thank you for calling in, and especially those of you who may have stayed late or taken some time out of your day to call in and listen. I think Doc White hit a lot of the high points, but some of the things I really want people to take away and consider is we're all tired of the world being shut down. We're all tired of our kids not being in school, of not being able to go out with friends to concerts and all those things. So the more people who get vaccinated, the more likely life is to go back to normal. I did not want to be a first grade teacher, and now I am a part-time first grade teacher, and I will happily give that back to the regular teachers. So that is kind of my reasoning for why I wanted to get the vaccine. Also, like Doc White said, if you're a healthy 25-year-old who may already have had COVID and didn't even feel sick, you're like, why do I need to take this? Well, for the same reasons he said, to protect the 80 and 90-year-olds in your family, anybody who's immunocompromised, and to get our world reopened so we can go back to normal life. I just hope that we get some good questions. I've had a lot of questions from people while I'm doing the vaccines, and from social media. I know is a big source of information for all of us these days, but it's not always correct. So please ask questions, and hopefully we can answer those for you.
And of course, Captain Koeppen and I are available outside of this meeting. This is what we do, and feel free to reach out to us if you see this later and you're not part of the live broadcast. We're happy to address those questions. And one thing I would repeat is I use the example of the common cold because it's a very similar organism. We all know you can catch the cold each year. And so the immunity that we as humans are able to develop against this organism is limited. It only lasts so long. And then when you get re-exposed, you get a cold again next year. The flu is a bit different in that it changes so much that the flu you're exposed to this year is going to be a different flu than you're exposed to next year. That does not seem to be the case with the coronavirus. We're encountering the same organism a year later. So does it change and morph a little bit? It sure does. But that doesn't change, as far as we can tell, that doesn't change the response to the vaccine. At this time, we're able to still prevent that illness.
Okay, so with that, we'll open it up for questions, and because the line was overloaded, I've been texted a couple of questions to start with from the recruiting command. Their first question is, when will the vaccine become mandatory?
We don't have an answer for that. In all honesty, I don't know. I was on the call with the joint surgeons last night, both Air and Army, and everybody asked that question, all the way up to the generals and the medical over there, and nobody knows. We're waiting for each of the different vaccines, the Pfizer, the Moderna, the others coming out behind it, to get the full FDA approval. That would have to be in place for a significant period of time before anybody can mandate vaccines to be taken. So it may happen, yes, but we don't know when.
The one thing I saw in the NGB information on that was, right now there is emergency approval from the FDA. And with emergency approval, they've made vaccinations for the military a voluntary status currently. When that becomes, NGB is and DOD is put out, when we receive full FDA approval, it will, like the flu shot, become mandatory. So that day is coming, it's just not here at this point. So, any questions, please?
What will happen if a pregnant person gets the vaccine? What will happen to the person who's pregnant or their baby?
Hey Chief, this is Captain Koeppen. So they have not done any studies officially in pregnant women or nursing mothers. However, I have been told by a very well-known OB in the state who's got a lot of credentials far above mine. She strongly recommended it for any mothers who are planning on getting pregnant, any women who are planning on becoming pregnant, and if you are a pregnant woman, to significantly have that conversation with your OB. Doc White, anything to add?
I think that's perfect advice. It's going to vary somewhat case by case depending on the woman's own medical history. So the best source of advice on that's going to be from your OBGYN. Mm-hmm. Perfectly safe to have before you're pregnant and after you're pregnant. We're not using this vaccine on children at this time.
Okay, next question, please.
I have a question.
Yes, go ahead.
So it might be kind of out there, but if we take these shots and we do this voluntarily, and then years down the road we find out there's adverse effects or whatever, will we be able to claim VA for this if we voluntarily took it?
So will you be able to get an LOD if you voluntarily took the vaccine?
Yeah, pretty much so. Just in case, 5-10 years down the road, something comes up.
Well, this is Dr. White. I think that's a fair and legitimate question. I also work full-time for the VA, so I feel like I can somewhat comfortably answer that. I've been a soldier for 20 years and a federal physician for 20 years. So one of the things that occurs when we do these immunization clinics is we provide you an opportunity to report any symptoms that you have. For example, with the VA, when we as staff got immunized there, we're given a piece of paper and we record, did you have muscle soreness today? Did you have any aches or pains? That sort of thing. And then at the time, after you've had your complete series, both vaccinations, those are returned to the people that immunized you. Within the Army, we're doing a computer-based, internet-based query where you can report, hey, I had the shot on this date and I developed the following symptoms. And so there is a track record that was given to you by the military, and that if you had any incident or condition with it, we could tie that to something you did while you were in the service.
All right, thank you.
I have a question. So if I have a soldier that has been or has gotten COVID, then recently has gotten the shot, and then up until recently was contact traced and was asked to quarantine, what is the point of the vaccine?
So the guidance for the vaccine, if you've been told, did he finish both of this series? That's my first question.
Just one series.
Just one. So the guidance is if you have been told to quarantine as part of a contact tracing, and you either have not yet received the vaccine or you're still in the middle of the course of getting both doses, you still complete the quarantine. And once you're done with your quarantine, you can get that second dose as long as you have no symptoms of COVID. Right now, the guidance from DOD and NGB, if you do have the vaccine on board, they are still requiring quarantines and they are still requiring ROMs or restriction of movement, depending on where you're traveling around the country and around the world. That is subject to change, but as it stands right now, the guidance is still a required quarantine.
You know, I'll jump in on that because it leads to kind of the next obvious question is, if I've undergone the full series of immunization, I've had both shots, and by all consideration I should be immune for some period of time after that, do I still have to wear a mask? Do I still have to quarantine? Do I have to avoid sitting close to people in the movie theater? Right now, this still remains a nationwide emergency response to a pandemic. That's a unique thing in our lifetime. And so we're having to follow rules that are put down by the federal government, by the DOD, by the state, by your county, by your employer. There's a whole cascade of guidance and rules that at times are in conflict with each other. So some of this is coming from science, and some of this is coming from rules and policies that may not be completely grounded in science. Doesn't mean it's not a good idea. So what we're shooting for right now is, once we've got a certain amount of the public vaccinated to where we think we can have kind of a generalized immunity in the community, then we can look at pulling off the restrictions on what businesses are open, wearing masks, that sort of thing. And so, again, that's an opportunity for us in the military to do our part, because we count in that pool. And so right now, it's kind of slow in our communities. I took my own father in last week to get his vaccination because he's over the age of 75. And it's almost a lottery system that you have to go through in order to get qualified. You race for tickets, and then you go down and you get the vaccine. Across the country, Montana is doing really, really well, ahead of other states on how we're responding, and we're getting that vaccine out. But it's still a trickle compared to what we would like to see. So the fact that in the military you can just show up to drill and say, I'm ready for my vaccine, let me have it, that helps us get that vaccine into the community like we need it to. Thank you for your question.
I have another texted question, sir. How soon after you've had COVID is it safe to get the vaccine?
I don't think we know. We don't have an answer to that. What we do know, and this is based on our experience with prior vaccines and research that has gone on through the years, is that you don't want to get too many vaccinations at the same time. So if I go in and I get a childhood shot, and then I need those to be spaced out by a month or by 2 months or by 6 months, your pediatrician or your family doctor will tell you, okay, your next shots will be due in a month or 6 months. It's the same thing we're facing with COVID. You have to have a certain amount of time for your body to respond to what it's been exposed to generate the particles that it needs to have immunity. And if it gets exposed to too many things at one time, you may not mount the strong response that we need to have out in the community. So I don't have an answer for how long after you've had COVID before you get the vaccine.
Would you suggest, sir, that they wait the 90 days, that they believe that COVID patients will have 90 days immunity, or before that?
I would use 1 month, because that's the recommendation we're giving to space it from other immunizations. And that would be a very similar circumstance, is we know you would be completely recovered and that you could mount a good response to it.
Okay.
And I
Thank you,
just
sir.
want to follow that up. I think the biggest part too, to just add on to what Doc White said, is if you are still symptomatic, obviously you should not get the vaccine. That's a pretty good guideline. If you've had COVID but you're well recovered, your symptoms may have been mild, or if they weren't mild, they were severe, make sure that you are completely symptom free before you step up to get the vaccine.
Okay, ma'am, thank you.
I'm going to again tag onto that with what's probably going to be an inevitable question coming in, so we might as well address it up front. What about those side effects? What about the symptoms when you get that immunization? Those are actually a good sign. I really think that's something we need to consider. So if I get an injection and it causes a sore arm for a couple of days, that tells us that your body recognizes it's been exposed to this thing that we're wanting to teach ourselves to produce an immune response to. If you get some mild symptoms, some body ache, some fatigue, some tiredness, that means you have a strong, healthy immune system and that it's working, that it recognizes that foreign particle and that it's ginning up all the supplies you need should you be exposed to it in nature. I would really hate to see someone avoid getting the immunization out of concern that they might get some side effects. Remember, the squeaky wheel gets the grease, it gets the attention, and so the very few people out in the community that have had significant reactions, everybody hears about it. They make it to the news, they make it to social media, it's in the newspaper. You don't hear about all the guys like me that I had a little bit of a sore arm for a day after both injections. And I see that left and right. I take care of patients all the time. So a little bit of side effects is a normal response. It tells you your immune system is working correctly.
Okay. Another question, please.
Yeah, what if I receive the first shot and for some reason I can't make it back within that window for the second shot? Would I have to start the series over again, or what do you think would happen?
So I can answer that. The guidance is if you go beyond the 40 or 42 days, you can still get your second dose. There's no recommendation to restart the series. They don't really know we have limited data on how an mRNA vaccine window changes. Like Doc White said, we have lots of childhood vaccines that have a set 3, 6, 9 months, for infants and things. This is the guidance. It's what it is right now, but we're not going to make you restart the series. So we've said a lot, if you're not available to come back and get that second dose in your 28 to 40 day window, we really kind of were hesitant. But now I'm seeing more and more guidance come out that even if you're going to be at a school or you're not going to be at drill next month, just go ahead and get that first dose, and we will get the second dose to you as soon as we can after that.
A lot has been made initially about the Moderna vaccine that we're administering right now. You come back at 4 weeks. With the Pfizer vaccine, you come back at 3 weeks to get your booster shot. We're making way too big a deal out of that. This actually isn't that critical. I hate to pull the carpet out from under my peers, but that's the truth. The package information, the manufacturers have now started saying, well, actually, if you get your shot at 6 weeks, it's giving the same immunity. So that gives us more leeway than we might have thought, and that makes good sense to me as a scientist, that it would have to be exactly 21 days or exactly 28 days. That doesn't make sense to me as a biologist. I will add to that if you think about it, if many of you might have had to undergo a booster for your measles, mumps, and rubella with MMR. When you enter college, when you're 18 years old, when you're 20 years old, when you take certain jobs, when you get into the military, we have you get a booster shot on some of these immunizations. Same thing happens as you get elderly. We do booster shots against things like the chicken pox that can cause shingles. And so it's a predictable thing that we know, whereas measles, mumps, and rubella, hopefully you're not getting exposed to that. So we need to re-expose you to it just enough to remind your body about it.
All right. Any further questions?
Just a quick question on the side effects. Obviously, we can see what's out there on social media and all the news outlets. From the force and who we have vaccinated, what are some of the general side effects that we're seeing with the COVID shot?
So the main things that I've seen as I've been doing a lot of the vaccinations during the week here, mostly just some sore arms. I've had a couple people say that the night they got the vaccine, they were a little more tired, and maybe a little bit of complaints of headaches. I've had a handful of people who said they've recently had COVID in the last 3 months or so that did say they felt pretty crummy for a day or two afterward. But like Doc White said, that is still a normal immune response, and it may be heightened because your body just fought off this virus. So that makes sense. It doesn't make you feel any better, but it does make sense.
And I'm a full-time emergency physician. Anybody who's remotely had any kind of a reaction, I've seen them, whether they're service members here or they're veterans or they're staff members next door. I have to say having a sore arm is very predictable. Having a period of a day or two where you're really tired and you want to stay in bed and sleep, fairly predictable. Anything that extends beyond that is not a normal reaction, and we'd advise you to report it to us and get evaluated and checked out. What I have seen 99.9% of the time, very mild symptoms, and I hate to call it a side effect, it's a predictable reaction.
So I have another question. If you have a serious side effect, how long would it take for that to come to be?
A very, very broad a range of responses. So if you were truly allergic to something in the vaccine, you would have a reaction there before our eyes while we're administering that. That's why we have you wait for 15 minutes after you have the injection. We have to have our eyes on you to see if you have any kind of an allergic response. That's the same thing with any vaccine. We have that same requirement. If you have had a legitimate allergic response to any other kind of immunization in years past, we have you sit there for 30 minutes just to be safe. It is important to know that this is a new and different kind of vaccine. It's really not unheard of. We've used it in other ways and methods before. This is the first time it's been out there in such mass quantities. And if you've had a reaction to another vaccine, doesn't mean you're going to have an allergic reaction to this one. This is completely different. So.
Well, thank you again.
I have another question that was texted in. Soldier wants to know if they're vaccinated, can they travel outside of the United States and not have to quarantine when they return?
Right now, as far as NGB and DOD say, that has not changed. Those restriction of movements, quarantines are required. However, there is some rumor that travel will be much easier for those who've been vaccinated. They may not be required to quarantine in other countries. And then once there's a broader vaccination amongst the U.S. population, we may see that lifted for those returning from outside the U.S.
That brings up another good point. Whether you're being vaccinated in your local community, through the public health service, at the fairgrounds, via the military, via your home primary care provider, wherever you wind up getting the vaccination, it's really important that you keep a record of that. You're going to be provided an immunization card that lists when both doses were administered. And the reality is, I think you're going to need to present that in order to travel internationally for quite some time. And so don't lose it because we can't regenerate it. We in the military have that ability because we have a better track on immunizations. But if you get a little white card from the fairgrounds and you lose it and then you decide you want to go to Tahiti, you're going to have trouble traveling internationally. So you really got to protect that piece of information.
And we're seeing some countries or some states require a negative COVID test before you can return or enter the country or return to work. I think this is going to start to replace the negative test. If you've been vaccinated, you won't have to test, and hopefully you won't have to quarantine either. When we travel to some countries, they do require like a yellow fever shot or malaria prophylaxis. This is really no different than that. It's just a new thing that's being required for a new virus. So.
All right. Do we have any other questions?
This is Major Hamilton. I was wondering if you guys might be able to touch on the safety and monitoring programs and adverse effect reporting.
So we have the reporting system available for all healthcare providers as we're given them at the TMC. If we do have any adverse reactions, it is reported, and DoD has provided all of that for us there at the MedDet. We have that on hand if there's anything reported. So that is going up. DoD has a close eye on that. They said again last night on the Joint Surgeons call, they're monitoring that closely, and they're asking people to make sure they're entering anything significantly different so that they can get a broad sense. They're also asking for us to report, if we get a vial of vaccine that doesn't look right, if the coloring's off, or if we're not getting the same amount of doses that we're supposed to be getting. So they are watching this very closely and tracking any adverse reactions.
And that's true, and that's mandatory reporting.
Right.
We have to report
That's
that.
with any vaccine.
It's always been that way. We're not overly concerned about the safety of this vaccine. I'm comfortable. I wouldn't have had my own arm injected twice if I wasn't comfortable getting the vaccine. But if you get a rabies shot, if you get a Japanese encephalitis shot, if you get a yellow fever shot, we always watch for those reactions and report them up so that we can track and modify and adjust the vaccines if there appears to be a problem with them.
Mm-hmm.
Oh, absolutely, sir. So my reference to that is more so for the people that aren't medical, that they would know what type of issues would be severe enough to bring that to their provider's attention.
So I would follow the guidance. I appreciate the question. That's good information for the soldiers and airmen to hear out in the field. Like I said earlier, we genuinely expect a sore arm, maybe some tiredness for a couple of days. If it's really something in excess of that and you're really down, then it needs to be reported, and you probably need to be evaluated. I can tell you most of the people that I've evaluated in the emergency department, oftentimes they had something else going on. It wasn't related actually to the vaccine. The timing makes you think so, but once I evaluated them and drew blood and examined them, it oftentimes turns out to be something different.
All right. Are there any more questions? Well, with that, thank you, General Hronek, Doc, Captain Koeppen. I appreciate everybody that dialed in and tried to educate the force, and we'll post this to the website, the Facebook page at the Montana Guard Facebook page, and we're also going to get it on the app or a link on the app so that soldiers can view this and learn more about COVID and the COVID vaccine. Thank you for your time.